Thank you all for coming today. This is something that I'm very passionate about. So we'll just go ahead and get started. I have been with the Bereavement Center off and on since 2013. And I've done probably just about everything there at the Bereavement Center. I went off and I got some experience at other places, and it was at Laurel Ridge and Child Safe where I began my journey with trauma. Began the TF-CBT certification process at Child Safe, and since then it's been a passion. When I went back to the Bereavement Center as a staff member, I was able to see the need for children who have childhood traumatic grief, and how can I use my certification for those children who have traumatic events. The main thing here is we're going to be talking about children who are stuck in the trauma, so they're not able to transition to that natural grieving process, and how I treat that. All right, so we do intakes at the Bereavement Center, and the first thing that we do after we introduce and we kind of build that rapport, we sit down with the families and we ask the children, what is grief? So does anybody have a definition for what is grief?
Mourning a loss.
Mourning a loss? Yeah. The objectives of this again is natural grief versus childhood traumatic grief. Trauma-Focused CBT practice model, so I'm going to go over the practice model that I do use, and then how I implement treatment with the childhood traumatic grief, utilizing those TF-CBT components, which creates the TG-CBT, a lot of acronyms, treatment plan. So again, what is grief? Feelings of intense sorrow, especially by somebody's death. Sometimes kids just don't even know what grief is. You just kind of sit there and like, well, I don't know, I'm sad. And that's the beginning, because sometimes that's the beginning of them identifying some of those feelings that they have. Uncomplicated bereavement, again, just intense sadness. There is no typical timeline for both grief and bereavement because there's so many factors. Of course, every story, it's like an onion. Everybody has their own layers, as you all know. So there's no typical timeline for grief. There's no typical timeline for the model that I use, but I will go into that. So I'm going to start out. What we utilize at the Bereavement Center is Warden's 4 tasks of mourning. So if y'all are not familiar with him, I'd like to go ahead and show you all the video.
Why don't we talk a little bit about the genesis of the editions? Because this 4th edition was published in 2009. Mm-hmm. The first edition was published in 1982. So
that's why.
What has changed and what has evolved in your thinking to distinguish this from the first edition?
Oh my goodness. Well, I think this reflects a lot of the research that's out there. I try to keep current with everybody's research. Some research is better than others, but try to keep the book current there. Basically, the book is centered around the tasks of mourning.
What are the tasks of mourning?
That when somebody loses a loved one to death, there are certain things that need to be accomplished, and so that's sort of the nexus of the book, the model. And the texts are, you first of all have to believe that it happened, and then deal with the affective pieces, and then adjust to a world without the person, and then find a way to move on without necessarily disconnecting from the dead person, some way to memorialize the person and move on. So.
And how would you distinguish your work, say, for example, from Kubler-Ross?
Well, Dr. Kubler-Ross was talking about stages of dying, and then along the way somebody, used those stages for bereavement. She never intended that, in my judgment, having done research with her in the early days. But I think any model that talks about stages really gets locked into sequential movement. Yeah, and so by using the task model, which comes from developmental psychology, there's certain tasks. These tasks have a fluidity. They can be worked, reworked. Some are very easy to accomplish. Others cause people to have some problems. And but it's a good model because if somebody's stuck in their grief, then it gives you an overlay, a model to figure out how they're stuck and why they're stuck and how to help them get moved on.
Okay, so basically what he was talking about was the 4 tasks and what's the difference between the 5 stages of dying versus the mourning, the 4 tasks of mourning. So basically we're just going to go through here, and the one thing I wanted y'all to take from that is that, can you hear me better? Okay. The one thing I wanted to take for that, he does talk about how grief is not sequential. And the way I describe it to some of our families is like a roller coaster. I went on this roller coaster one time in Disneyland. It was called the Mummy. And it goes really fast, and you're going, and you're going, you go, and then all of a sudden it's like this jerk stop. And then when it stops, you don't even know what's happening, and you go backwards. And that's kind of what grief is. It's that roller coaster, because sometimes you may be in a different stage, and some of our families are like, wait a minute, this has been 3 years since the event happened. And, why is she not doing so well today? It's like, well, the reason being is that's that roller coaster ride. But hopefully we have given her the tools in that 3 years that, yes, she's having a bad day, she's having a rough time. But with those tools that we have hopefully given to her, she doesn't stay in the dark as long as she did as when she was first in her journey. Does that make sense? So that's our goal. So the 4 tasks, basically 1, accepting the reality of the loss. So they come in and it's like, okay, this is really happening. This is my life right now. I have to accept that this person is not coming back. And that's really difficult for our youngers because they don't have that development where they understand time, or they think they're on vacation. So that's something that we have to do with them. Also, task 2, processing the pain of the grief. What that is, okay, I'm trying to accept that this person is dead. What am I feeling? Sometimes those kids are, I don't know, and the parents don't understand that I don't know is real. They don't know. It's kind of like scribbles. And they're feeling all of these things inside. They can't even identify what they're feeling, much less where they're feeling. So that's what we can help do in task 2. Task 3, all right, so I'm trying to accept the reality of this loss. I am trying to identify what I'm feeling, where I'm feeling it, where I'm getting triggered. Now, how do I adjust to a world without this person? How do I go to school without my sister? How do I go to school and I see other moms dropping off their children and my mom is dead? How do I adjust to that? How do I live in this home where this person is no longer there? So that's task 3. As you can see, we are going to be going back and forth from task 1 to 3 during our treatment, because that's really difficult for our children. And then task 4, that is just, okay, how do I honor this person? How do I make sense of what happened? And maybe I didn't want to do the same things that I did before for a while, but maybe I want to start playing basketball again. Maybe I want to start doing things and making meaning of my life again and trying to go back to things that I used to like to do. So that's the task, that's what we use. And then what I'm going to hopefully show you today is how do I use my model with the 4 tasks. So I'm kind of combining them both and using that model for my kids at the center. All right, childhood traumatic grief. Okay, this happens when there's been a traumatic event. The children starts to show PTSD symptoms. Again, there's anger, the hyperarousal, avoidance to the death, overwhelmed by the trauma experience. That's basic PTSD. A lot of clinicians here understand what the symptoms are. Accompanied with depressive symptoms and unresolved grief symptoms. This is where they're stuck. This is where I talk about maybe they're not going to play baseball anymore because guess what? Dad's not in the stands anymore. So they're going to start to avoid things that they used to like to do because of that trigger. And sometimes they don't understand, well, we want them to move on. We want them to go back to doing whatever they used to like to do, but sometimes they just can't because those things that they're not even able to identify yet. But a lot of those things is, I'm doing this and that person's not here anymore, so I don't find joy.
The word traumatic on the first line, Is that like tragic?
A tragic death. For example, we're going to do a case study, but anything that is traumatic, there could be a witness to a suicide. It could be a violent death. It could be finding parent in the bed dead. I mean, it could be any type of trauma that the child has witnessed, has been firsthand to, because we do have a lot of violent events also where the children were there. So any type of traumatic event. Some of the symptoms, again, the unwilling to accept the death. And that comes out a lot with children in certain words that they're not ready to say. And that's what we do. We hopefully will give them the vocabulary, and we will say the things that they're not ready to say. For example, they'll say, well, let me give you an example at the center. We use the word dead. We use the word death. We have families that say, so-and-so passed away. We will never correct them, but we continue to use those words until they're ready to use those words. But that's the type of thing where it's kind of accepting the death, and that's what we do, hopefully, for them. So there's the intrusive thoughts. Those are just the flashbacks that they have. It's like the film strip that gets stuck on that, or whatever triggers them, they're going to get stuck on those memories. Being constricted, being numb, avoiding the pain. Again, those are where a lot of the maladaptive behaviors come. Positive memory avoidance due to triggers of death. Again, there's those positive memories. Well, no, I don't want to talk about, when I won something in some sports because so-and-so's not here anymore. So they kind of connect that to the death, and that is a big trigger for them. Guilty feelings towards forming new relationships. This happens a lot when they're a little longer in their journey and then they're trying to form relationships with maybe a different caregiver, or maybe a caregiver has brought somebody else into the family. So maybe there's a step-parent, or maybe there's an aunt or an uncle who's helping, or maybe we had to leave our home in West Texas and now we're in San Antonio living with grandparents. And then they're having fun, and it's like, oh, wait a minute, I shouldn't be having fun. My dad just died. So there's a lot of those guilty feelings of forming new relationships. Reduced engagement in age-appropriate activities. Again, that's the same thing as, no, I don't want to join volleyball. No, I don't want to go back to swimming because my person is not in the audience anymore. And that's a really big trigger for our kids. So the trauma symptoms are blocking that natural process, the natural mourning process. That's the big thing that I would like for you all to leave with. And I put that throughout the slideshow. But those symptoms, those are the kiddos that are stuck. Those are the kiddos that are not able to have a natural grieving process because they're stuck in that trauma. And hopefully, our job is to help treat the trauma in order for them to get to that natural grieving process. So some of the assessment tools that I use is the TSCC and the TSCYC. And then what the center, that is the TSCC, if y'all are familiar, that's the TF-CBT assessment tool that we use for our children with any type of trauma, whether it be physical, sexual, or neglect. And then the Grief-Informed Foundations of Treatment, that's one of the new assessment tools that we're using at the Bereavement Center. This one, I have some information on it, I just didn't put it on here, but it's pretty new. What they're doing is they are assessing different aspects of the loss. And in order for us to figure out, is this something that we need to treat with maybe some PTSD, or is it more mood? That is our tool that we use, and that's how I identify some of the kiddos that have a very traumatic event, and I have to do something different than just the normal process of treating the bereavement. Okay, so practice components. Did y'all get a copy of the practice? It had all the components. No? It had practice? No? Okay. So practice are the components of TF-CBT. So The first one is psychoeducation and parenting skills. By using this is going to help facilitate the healing at home. So this is where parents are coming in for the first time, and they may report, oh, you know, so-and-so is regressing, so-and-so is wetting the bed, so-and-so, they're just having some behaviors that they're not used to, but actually they're just symptomatic of the trauma. So by giving them information, just sitting there, that's when the exhales of the parents or the caregivers are like, oh, okay, so that's natural for someone who has been through a trauma. And that helps normalize some of the behaviors that the children are having at home, where caregivers don't even know what's going on. Oh, they're not listening. Oh, they're acting out. So we hopefully will give them those tools to understand, why are they acting out? What's going on with them? And in that, we are normalizing those symptomatic behaviors. Relaxation skills. This is learning to relax and self-regulate in order to be comfortable speaking about the uncomfortable. These kiddos seeing things that are unimaginable. And how can you talk about this without giving those kiddos the tools that they need to self-regulate? So hopefully what we do is we have several things that can help them be uncomfortable or become more comfortable talking about those uncomfortable things, those uncomfortable thoughts that they are having. So that's where the relaxation skills come into, especially when they're in the narrative part and they are trying to share their narrative. If it gets so intense, then they have those tools. They know how to self-regulate when they're in the narrative portion. So affective modulation skills, that's just identifying those emotions. We're giving them that vocabulary. So they're identifying that. What we do at the center is we have, during the intake, what we call a grief circle. And the parents will, or the caregivers and the intake personnel will sit down and we'll ask them to draw a big circle. And we'll ask them, so what is grief? They'll try and answer that. We'll help normalize their answers. And then we'll say, well, what are some of the things that you were feeling when this person died? And so we help them identify some of those emotions. So they'll write those emotions in that circle. And then what we're going to do is we're going to give them some colored markers, and we're going to say, circle that emotion to the color you feel that matches. So if they're angry, is that red? And they'll circle it in red. If they're confused, what color is your confused? And then they'll circle that. So now they're looking at their paper, and everything that's been inside, it's tangible. They can see it. We've helped them just in that 15, 20 minutes identify what they've been feeling. Now what we do is we're going to get up as a family and we're going to put some color to that. And we have a spin art machine, and then they create their own spin art as a family. And I really like the family to get up together and kind of work through this, because sometimes the intake is the first time that the family is actually talking about the event together. So that's really important. So giving those kiddos the vocabulary, helping them identify that, also helping them say the words that they're not ready to say. Then comes the cognitive coping skills. That's the C part of it. So identifying those negative thoughts or those cognitive distortions in order to make connections with their thoughts, feelings, and behaviors. And that's why I put a triangle there, so we're going to do that here. But that is just, okay, I know how to self-regulate with the help of my therapist. I'm trying to identify all of these emotions, and I forgot, the most important thing is I'm starting to share these emotions with my caregiver.